Good afternoon.
Hello.
How are you today?
Good, how are you?
I'm good. My name is Philip Quallen. I'm a first-year med student at FAU. May I have your name, please?
Mary Nancy,
All right. May I have your age?
19,
And what gender do you prefer to go by?
a female.
Female. All right. So today we're gonna go into a heart exam. It should take me about 15 minutes. Do you have any time constraints I should know about?
Mm-mm.
All right. Do you need a chaperone or translator in the room?
Mm-mm.
Are you comfortable right now?
Yes.
All right. So, can I have you lay back first?
Yeah, of course.
Thank you. So, for the cardiovascular exam, we're going to do it supine at 30 degrees. And so the very first thing I'm going to do is inspect her neck, and I'm going to look for JVD, or jugular venous distension. All right, so may I ask you to tilt your neck to the left, please? All right. So what I'm going to do is I'm going to get a pen light, or you can use lights here, and you want to use tangential lighting, and you want to look for any shadowing. And if you don't see any, then you can assume that she has no JVD, which I don't see any on this side. And then it's also important to check both sides. So I'm going to go from this side as well, pardon me now, and then look here, and I see none either there. All right. So now I'm going to go ahead and I'm going to listen to your carotids. And this is important because you want to auscultate the carotids before you palpate, because of the risk that you might dislodge a clot that will travel up to the brain. All right, pardon me. All right. Okay. No bruise noted. And notice how I auscultated higher up. When I palpate now, I'm going to palpate lower down. So now I'm going to palpate for the carotid pulse. All right. And now I'm going to palpate here as well. All right. So now I'm going to inspect the chest. Do you mind if I lower your gown now?
Mm-hmm.
All right. Oh, thank you, ma'am. All right, so the first thing I'm going to do, I'm going to look for symmetry of the chest. I'm going to look for any scars, any deformities. I see none, that when the patient lays down, you want to make sure that her legs are supported, so she's comfortable. All right, so the very first thing I'm going to do is look for the PMI now. May I have you lift your left breast up, please? So I'm going to look for any obvious pulsations, and I see none. And so now I'm going to go ahead and palpate for it. May I have you lift it up again? Thank you, ma'am. So first I'm going to use my entire hand. And then when I've isolated it, then I'll use my fingertips. And you want to estimate the size. It should be around 2 centimeters. When normal. All right, which is what I found. All right, so now I'm going to go ahead and also palpate for heaves and lifts and thrills. So heaves and lifts, you want to use the entire palm of your hand. And the point is, you want to feel for a visible lifting of the chest, which would be evident in left ventricular hypertrophy, for example. And so, do you mind if I feel here? All right. And then here, and I feel none. And then for thrills are essentially palpable murmurs. So you want to use the base of your hand because it's a little more sensitive. So now that I've palpated, I'm going to go ahead and auscultate. So I'm going to listen at four parts, both with the diaphragm and with the bell. First at the aortic valve, then the pulmonic, then the tricuspid, and lastly at the mitral. May I have you lift your left breast up, please? Thank you. And I'll do the same with the bell. Could you lift it up again? All right, thank you. one other note that when you listen, you should be able to hear the normal heart sounds, S1 and S2. And two other maneuvers that you should do at this point is, may I have you lean on your left side, please? So when you have the patient in the left lateral decubitus position, as such, you want to use the bell of the stethoscope to listen for any mitral stenosis at the cardiac apex. Pardon me. All right, thank you. And then lastly, going to have you sit up. Lean forward as well. And then the other procedure you want to do is you want to use the diaphragm of the stethoscope to listen at the tricuspid for any aortic regurgitation. Pardon? All right. And then all right. And in short, that concludes the cardiovascular exam. Also, after you listen to the heart, now you need to check the peripheral pulses and also examine the legs for any, say, edema, any venous changes or venous swelling. So I'm going to go ahead and listen or feel your first. Have you lift out your arms? Yeah. First, I'm going to feel your radial pulses. All right. Both symmetric and regular. I'm going to feel your brachial. Go and relax your arm. All right, and I'll feel it on the other arm as well. All right, and then normally at this point we would feel for the femoral pulse, but we don't normally do that in SPs. And then next I'm going to feel your popliteal. So the key here is, you mind if I lift this up? All right, so you want to essentially take your fingers, get behind the knee, and you want to try and grab the popliteal, because it's going to be a very deep artery. All right, and then you want to do the same for the other leg. All right, and then lastly, you want to check the dorsalis pedis pulses and the posterior tibial pulses. Do you mind if I check them here? All right, so the posterior tibial is going to be on the medial side of the foot, behind the ankle. Pardon me. And the dorsalis pedis is going to be roughly in between the big toe and the toe next to it, going down the foot. All right. And at this point, when you're assessing for pulses, then you can look at the lower extremities for any edema, any swelling, any venous changes down there. So, in essence, that concludes the cardiovascular exam.